want to wait for another five minutes or so?
The broadcast is now starting. All attendees are in listen-only mode.
Hi everybody. I hope everybody can hear us out over there. If there is any problem, you can chat back to us and just click on that, that if you cannot hear it. I'll be thankful to, if you can just revert back to us so that we are sure about you can hear it. Okay, I can see the replies over here. Okay, so here we start. This is basically, we saw the need of conducting this webinar basically because of a lot of confusions happening in India at the moment on the medical admission systems. Every day we come to know about the new judgment which is coming out from the Supreme Court, and most of the students are on the edge at this moment. So probably this could give you a better option to look at and understand how it all works. What could be the best option to, start working on your medical admission systems. So here, there are many options that you have, of course. One of them probably, as per us, the best option that we consider today is, the American programs. Now here it shows the website which you can note it down if you can, right now if you have a pen and a paper. It would be very easy tomorrow whenever you have spare time to go through the entire website and you can understand it at much more detail, because today we have only 1 hour to discuss the whole thing. I move forward from here. The bottom part gives you the the introduction to who I am, probably what I do, and what I have been doing for many years now. What we are here, what my part, we have, as you must have received in the email, there are 3 people on the call at the moment. I myself am Dhananjay Shah. We also have one of the most reputed doctor who has agreed to be there on our panel and probably guide you up, okay, for the medical journey, Dr. Ishan Mehta. And we are very fortunate to have Dr. Rajiv Pandey, who happens to be the Assistant Dean to Spartan Health and Science University. Okay, the basically university puts our Indian students and lot of international students to the US roadmap, right up to PG. So let me just take, since you can see it's a very short presentation, I have only 10 minutes to go through. Okay, so I'll just start with the presentation without wasting much time on that. We all know this. Basically, the admission in India is not an easy task. This graph basically shows 2015 what had happened to the students. It would be now, right now, you don't have many exams to be worried about. It is time for you to understand what happened last year to so many students who are aspiring to become doctor. You can probably judge yourself what could happen this year. Of course, this year is even worse because of the confusion being put in because of AIPMT to NIT 1 and NIT 2, and people are not knowing very clearly about the methodology of giving admissions. In any case, there are 6.5 lakh students who have already appeared for NIT at the moment for 40,000 medical seats. I'm saying 40,000, that includes the private medical colleges, because now no private college or deemed university can take exams as per the yesterday's Supreme Court order. So all the exams for medical MBBS as well as BDS has been cancelled for private. So these seats will also be given through NIT 1 and NIT 2. You can understand, of course, these seats will not be cheap. We'll see that later how it works out, but we all know that 30% are through donations and 70% will be through NIT 1 and NIT 2. Around 20,000 of these seats are in the government medical colleges, which makes the success ratio of less than 0.3%. Out of that, 50% will be reserved seats and 50% will be for the open. And that's what makes MBBS in India, the admissions very, very difficult. The point is, you must have a plan B at this moment in order to ensure that you don't waste one more year. Almost 18% of the students repeat every year in India because they did not have the right statistics in their mind before they started the journey. I am now beginning to introduce you the MBBS in USA as the option at this moment which is available with you. What it consists of, how can one do? See, the system in USA is quite different. There is a route which is available with us wherein lots of Indians have chosen, students have gone happily studying over there. You can see it on your screen. If you do your 12th level in India, the first year of foundation year needs to be done in order to match with the American system. And after this, 4+4 is the standard American system right up to PG. First 4 years is the bachelor after foundation and next 4 years is PG, residency. You have heard about USMLE 1. We have Dr. Ishan to explain you in the next slides what this is all about, how these exams could be cracked, where are the success factors. He can share all of those things. Why people go for MBBS in USA, as you may be knowing about our website, we offer you in 9 countries, but we always say this is the best option. Why? Because if you do it from USA, there is a possibility of avoiding MCI screening test, which is the most dreaded exam for the people who are studying abroad. As you can see, it is not required once you finish your studies in USA. As per medical council rules, if anybody wants a link to the constitution of MCI which specifies this rule, they can connect back to us and we can send you those links to ensure that you don't need to appear for MCI screening test once you complete your education in USA. Basically, it consists of around 13 trimesters. This 1 year will lead to a BS degree and this 4 years will lead to a MD degree, and further 4 years leads to a board certified post graduation in USA. I hope it is very clear. However, there is a small catch. This whole 9 years will not be spent in USA as one would expect. The first 3 years will have to be there in St. Lucia. Your entry point in USA is only after you crack USMLE 1 over here. So you will be prepared at the Caribbean islands at one of the finest universities available there. Crack USMLE 1, and from here onwards you can go for the clinical rotation inside USA and then the post graduation. So this 6 years will be in USA, this 3 years will be in Caribbean islands. I hope it is very clear from the slide now. And moving forward, where is this St. Lucia? Everybody will think, where is this Caribbean island? We all know West Indies, we all know the cricket team, but where is this island? This is South America. This is the North American part, okay, what we call US, in the normal terminology. So this is where you spend your first 3 years on the island, crack your USMLE 1, and you fly down to US for the next 6 years journey, right up to PG. There are many benefits, of course, of doing it in USA. As you can see it listed over here, if you read it, lots and lots of Indian students are now taking interest because there is no donation, there is no entrance test, the scholarships are available for Indian students. education loan is available through Credila, HDFC. It is up to PG. It is not only MBBS. This is the biggest advantage of this program. In India, the donations for PG will run into crores. So you are not only avoiding donation now, but even at the PG level. There is no MCI screening test required. The cost option is hardly, it is almost matching with the private medical college of India. So we always wonder why a student takes an admission in a private college. Forget about with donation. I am talking about the without donation fees. What you pay in the private colleges is almost the same fees that the Caribbean Island University, which is Spartan Health and Science University, will take. So it's almost the same amount. The veg and non-veg Indian food is available. There are already 100 students on the campus, Indian students from various cities, from Mumbai, from Gujarat, from South, everywhere the students are available now over there. There are hundreds of examples of success stories already right up to PG. So it's not an experiment. You get the stipend during residency. So if you, whatever amount that you spend over here, what we call low cost option, you actually have a chance to get it back during residency. The main challenge is over here, USMLE 1. Once you crack it, you are in. This is the kind of cost, you know. Their approximate cost, you know, multiplied dollar by 65. So plus or minus 3 to 5% you can always consider. As you can see, it is almost matching, each yearly cost is almost matching with any Indian private college. The hostel, the living, the other costs, everything put together, this is the kind of a cost. And on top of it, we also have scholarships from the university in India. The scholarships are available from this. You can go it on the website to understand what are the maximum scholarships that you can get. You please note down this website. You can easily go through the, you know, there I'll show you the website screenshots, etc. later on, so that you can actually, there is a system which is online system wherein you can apply, get the admission, track the admission, pay the university application fee. Everything can be done online, and you will get everything online, the replies, the, you know, the whole system is online from MOKSH 16. Many people ask me why this MOKSH 16 is because generally we found that people who want to become a doctor, the dream is formed at the age of either 15 or 16. So we started with, you know, MOKSH16.com as our website. I'm sure this must be true even for you. So these are the kind of costs that you can see. So before you think of, you know, even approaching or taking up a call, sorry, from an agent, from a private college, I would advise you, note all these figures. There is absolutely no need to give donation. The admission is guaranteed. There is no MCI screening test, not to worry about this test. Everything is quite positive. Scholarship is worth around 10 lakh rupees distributed in 3 years. I hope it is very clear to all of you. I would now request Dr. Ishan Mehta to take it forward from here, the section 2. Dr. Ishan.
Good afternoon. Yeah, good afternoon, everybody. Thank you, Mr. Shah, and I'm really privileged to be here. I'd also like to welcome Dr. Pandey. It's been very kind of you, sir, to join us at, you know, I am sure it's very early in the morning there.
Thank you very much.
Because of the limitation of time, I think myself and Dr. Pandey would like to even encourage students to ask their questions in the question box. I can see 2 of the students who have already asked the questions, and we'll also try to answer them as and when we explain them about USMLE and the various accreditation. The seminar, I think, would be over by 4:30, so I'd like to encourage everybody to ask questions in the question box. Let me now talk about the USMLE exams. I'm sure Mr. Shah has covered quite a lot of points, and he has covered the roadmap to USA. Let me tell you, all of you guys, that for the first 3 years you will be studying in St. Lucia. The entire course is designed in such a way that the students are able to compete in the USMLE Step 1 examination. The example is 90% of the students from Spartan University would clear Step 1 examination in their first attempt itself. Whereas the students who have studied in India, I think just 10% of them would clear the USMLE Step 1 in their first attempt. So the entire syllabus curriculum is based on the USMLE Step 1 examination, and all the professors and lecturers make sure that the students are, well trained for the Step 1 examination. After completion of your Step 1 examination, students move to USA for their clinical rotation. While I'm explaining this clinical rotation, let me also answer the question of this gentleman who has asked that my student might get admission in private college in India. Do you think it would be better to go to USA? Let me be very clear about this, that no Indian medical school has the kind of facilities that you will find in Spartan Health Science Universities. They have skills labs, they have human simulation lab. The whole process of learning is not rote learning as we find it in India. It's actually based on intuitive learning examinations. I mean, they ask students to prepare presentation. There are examinations which are conducted on a bi-weekly basis. The students, they can learn or develop their skills in the skills lab. There are these human simulation dummies which would exactly act as if, for example, there is a heart attack patient. The students could learn hands-on how the heart attack patient would behave on this human simulation lab. Now, all these students would be doing 2 years of clinical rotations in USA, in US hospitals, along with American medical students. So the kind of experience and exposure and knowledge that they will get in USA would be far ahead than what you will get in India. In India, the internship is only for 1 year. Most boys won't be allowed to go into the gynecological department. Most girls would have a problem going into the urology department, like say prostate or all the other things. Here in clinical rotations, it's mandatory, like for example, 20 weeks of surgery, 20 weeks of medicine, 6 weeks of pediatrics, 6 weeks of gynec, and so on and so forth. So the students would get a comprehensive understanding of the entire medical course. There is absolutely no option. After each and every rotation, there would be again an examination. So the quality of learning that the students would get in St. Lucia and in USA would be far better than any medical school in India. So this is one point which I think everybody must take into consideration. Clinical rotation actually is divided into two parts. One is core rotations, the mandatory rotations that I just illustrated, and the other part is the elective rotations. Students also get an opportunity to select in which field they want to get more expertise. Each clinical, let's say this elective rotation could be of 2 to 4 weeks. And for example, somebody is interested in gynecology, he can do 4 weeks more of gynecology. So after completion of your core rotation, students are advised to appear for USMLE Step 2 examination. Again, the university and the hospital in which you would be doing your clinical rotation would help you and guide you on how to complete your USMLE Step 2 examination. On completion of your Step 2 examination, the university will make sure that you will get necessary letters of recommendation. They will guide you how to apply for residency, and they will try and train you for your interview once you get this residency call. Now residency, let me just make it easier for you to understand. What we call PG is known as residency in USA. Now, as Mr. Shah also pointed out in his briefing, about 35 students apply for residency every year in USA, and I'm talking about IMGs, 35,000 international medical graduates, which your son or daughter would be if they study from St. Lucia. So about 35,000 IMGs apply for residency every year in USA, and about 17,000 of them, they do get into this residency position. So if you are just in the top 40 to 50%, getting into a residency or a PG degree in USA is more or less ensured. Whereas in India, as Mr. Shah pointed out, it's really hard to get into even the UG program. PG program, it's absolutely more or less impossible for just above average students. You need to get into top 5% to get into the PG program in India. Whereas if you do your 5-year studies in St. Lucia and USA, complete your step 1, step 2, take guidance from university how to apply for residency, and if you get above average score, every time this score is different, but it is generally about 230 marks. Last year, 230 marks was the average USMLE score. Students getting more than 230 marks are more or less certain to get residency position in India. Residency position in USA. Now, if you do get into this residency position, according to the rules of government of United States, you get the minimum of $50,000 annually as stipend. Your total course fees won't be more than $75,000. So just within 2 years, you will be able to get back all the money that you have spent on your UG program that you will be doing from St. Lucia in USA. So the biggest benefit for the gentleman who asked whether to take this admission in private school in India, to answer him, if you do your MBBS from India, the government of India has just made it very clear to Supreme Court that they will not be giving no objection to written certificate to students who would have completed their MBBS from India. So if you complete your MBBS from India, the fee structure in private universities would be close to 12 to 15 lakh rupees. Doing it from St. Lucia, USA would be much cheaper and better. Your son or daughter would get more exposure, more knowledge. He will be in a position to come back to India and practice in India. He will also have this grand opportunity of making it big in United States. He can apply for residency. 50% of the students, they get into residency program. About 90% of the students who have graduated from Spartan, they get into residency program in United States. Even if the students do not get into residency program in the first attempt, they can always go back to the Caribbean country and take up a teaching job or a research job, and then again apply for residency a year after. So you'll be completing your MD plus your PG program in a span of just 8 to 9 years, which is comparable to India. Now there are about 35 to 40 universities in Caribbean islands. There are quite a lot of universities which fudge some of the facts. It is very important to know that in order to be eligible for residency in USA, the clinical rotations have to be ACGME up Green Book. Some of the universities would just give you observerships. They will tell you that it's clinical rotations, but they won't be clinical rotations. So one has to be very cautious about these things. Clinical rotations in USA have to be Green Book and ACGME approved. I cannot repeat or stress on this point more. There are just about 5 to 10 universities in the entire Caribbean which offer Green Book ACGME approved clinical rotation. Spartan is one of them. One more thing I'd like to tell you is the hospitals in which you would be doing your clinical rotations, they have to be in contract with the university. Only then you will be able to get the B1 visa necessary to do your clinical rotations in USA. Now, as Mr. Shah has pointed to this slide, observership versus clerkship. Observership means you will be learning at a clinical facility in USA, but the hospital would not know. There would be no record of you in the hospital. So whenever the residency director in USA would write a letter or email or would ask the hospital, there would be no record. This is a very cheap option which most Caribbean universities offer in order to lure in the Indian students and to fool them. So just be very careful that you are doing clinical rotations, clerkships which are ACGME and Green Book approved. Beware of some of the fraudulent universities which only offer observership, because if you do observership, you won't be able to practice medicine either in United States or in Caribbean islands, and either be eligible to do it in India. So beware of some of these people who do not offer clinical rotations. And let me also answer one of the questions which the other gentleman asked on whether his degree is valid in India or not. Now, if you do your 5-year program from St. Lucia in USA, this degree would be valid in India. Spartan University of Health Science is accredited university. It has affiliation from the government of St. Lucia. There are just about 7 universities in the entire Caribbean which are CAM-HP accredited. Now, CAM-HP is one of the most prestigious accreditation that any Caribbean university could get. Because of this accreditation, students who have studied from Spartan Health Science universities can also do the residency or PG from any of the universities in the entire West Indies, entire Caribbean, not only just St. Lucia. They can do it from Trinidad as well. So, and in a matter of 2 or 3 years, I think the government is going to make it mandatory that only the universities who are accredited with CAM-HP would be able to have their clinical campus in St. Lucia and in West Indies. So make sure that you also look for such accreditations. Spartan Health Science University is also accredited by FAMER. That is the only reason why you are eligible to appear for USMLE Step 1 and Step 2 examination. You would be also eligible to give the MCI screening test if you do decide to come back to India after say 5 years. If you do your residency in United States, you are not supposed to give the MCI screening test examination. You can directly get yourself registered. So this is one of the most accredited universities that you will find in the entire Caribbean. It's ranked about 5th or 6th in the entire Caribbean. Let's move ahead with the another slide, Mr. Shah, as I feel that it's already 4 p.m.
Okay, I take over from here a very small introduction, and we hand it over to Dr. Pandey, because I am sure that all the students are waiting to talk to him and ask questions. Here is the how the entire admission takes place. Okay, there is a website which is MOKSH16.com. If you go there on the MOKSH16.com, just click on apply now. I'll show you where it is. Fill up your details, submit, even including the online payment. Everything is available. You don't need to worry about admission. It's been made so simplified. This is the website. When you go MOKSH16, over here the main MBBS. Okay, when you go to MBBS, select MBBS in USA. Okay, over here you will find Spartan. We of course have recommended Spartan over here. As you can see the entire university details, and then simply there is a button over here, apply now. When you do the apply now button, you'll go through this process and your admission is done. Entire admission process throughout the journey, you will have your own student login ID, wherein everything will be mentioned, whether the admission letter interview is freezed, or admission letter is generated, or scholarship has been approved, or visa waiver has been arrived, or every damn thing will be mentioned on your student login ID. Once you log in, you will know the entire progress of your admission. So you don't need to worry or ask for support or be in the general mood that whether it has been done, when it will be done, all those things. So the whole system has been automized now, and I'll be very happy if you can make use of this system. The process is very simple. You can do the application through MOKSH at this website as I showed you. Dr. Pandey and other professors will be taking your personal interview on Skype. After going through all the documentations, your scholarship applications will be approved. On approval, you will be intimated of the same, and then the final admission letter will be generated, and all those things will be available at your student login over here. So at any point of time, the process is going to be very smooth. How MOKSH helps you can see it on your screen. So basically, we do everything right up to dropping the child to the doorstep of his apartment, start to finish. So all those things, you can download the registration form to know the actual pre-departure cost that needs to be paid, including the travel, the everything like that, the air tickets, and everything will be done, including booking of your apartment or initial settling down or taking you right up to there, ensuring your admission system is gone through, forex, travel insurance, everything will be done, because we have been doing this for quite some time now. Here I would like to introduce you all to Dr. Rajiv Pandey. You can read the introduction in a very brief manner that has been given over here. And now the whole thing is open for you to ask as many questions as you want. I think we try to finish quickly because you can spend more time with him at the moment. That's more important. So, Dr. Pandey?
Yes, hello.
Yeah.
Hello everyone.
Yeah, I think they are utilizing the chat mode, most of the students, actually.
Okay.
So,
I think there is a problem. I can't see the chat messages.
yeah.
Okay, sir. Let me, if somebody sends a question to this,
That's a
I'll
better way.
let you know.
Yeah, Dr.
But
I think, sir,
two sentences that I want to add before starting the question answer session to all the participants. Hello.
Yeah, sir.
I've lost the audio link.
Yes, so the few sentences that I want to add on behalf of the Spartan Health Sciences University, that our university is basically the 36 years old university, the well established, and like Dr. Ishan Mehta was telling, the number of the graduates, so far we have the history of 2,200 graduates, those are practicing all over the world, okay? And recently for our Indian students, we made a one announcement, or you can say we made a one arrangement, that is under the US immigration, they have the one med clerkship visa options, okay? Now we have the sponsorship from one of the US hospitals for our Indian student, and they can directly, we will provide them the letter, and they can go and directly approach to the US Embassy to get their visa for the mid-clinical rotations in the US. The only restriction that we have, they have to do the rotation with that hospital only, those who's going to sponsor them. Okay? So that's the one thing. And now session is open for everyone. Okay, you can ask the questions. I will.
Sir, there is
Sir,
one
it would
question
be,
that I can see over here is what are the requirements for getting a scholarship? If you can address that, then you can.
Okay, basically the scholarship is on merit basis. Okay, and if your percentage is more than 85%, you usually get a 40% discount on your tuition fee. If the percentage is 75 and above, 75 to 85%, you will get around 20 to 30% of the scholarship, and the 65% to 75% is the minimal 10% to 20% scholarship will be awarded.
Okay, there is
so
one
we'll
more
be also
question.
very grateful if you could,
There is one.
if you could explain about, this human simulation lab and the skill lab, because
Yes,
most Indian students won't know about it, and that's one of the major advantages of doing this thing from St. Lucia and USA.
okay, the basic purpose of having this clinical skills lab is basically the demo-based lab, because it's almost mandatory in the US curriculum. Because the US curriculum, the way it's designed, it's the first 20 months you are going to have the theoretical experience, and the last 20 months in the clinical rotations you are going to have the human interaction, directly the patient interaction. So what Spartan has done, Spartan started the simulation lab and the skills lab during the basic medical sciences, where you are going to have the hands-on experiment, okay, and you are going to learn all the clinical aspects with the dummies, okay. So we have the Harvey simulation lab, that's basically the automatic machine that generates the symptoms of the human body, and as a physician you have to observe the conditions and you have to diagnose the condition, okay. So the skills lab is basically the same way, okay? So where you are going to have the different types of the conditions in the patients, okay, in the individuals, where we have the dummies, and you have to diagnose the condition. Recently we started the OSCE program as well. That's basically the simulated patient. Okay? And we called it a skilled patient. The SP is we called, it's a very popular in the US. So now we are getting the skilled patient, or you can say the patient actor from the US. Those usually comes twice in a year to train our student, and they act or behave like a patient, where you have to diagnose the condition and then you have to treat the patient or prescribe the medicine as well. So this one is the basically before entering into the clinical, you must have all the exposures. We have started these programs as well.
Right. Thank you so very much, sir. Thank you. And this would also help the students in their USMLE Step 2 examinations.
Yeah, definitely. These all skills lab, simulation lab, and the SPs program is basically for the higher passing rate in the Step 2.
Right, right, sir.
Dr. Pandey, there is one more question here. What are my options if I am not able to clear USMLE Step 1 after completing BS? I think Dr. Ishan, if you can explain along with Dr. Pandey.
Sure.
Yes.
Sure.
Let me take over on this one a little bit. Basically, our 90% of the student easily qualifies the USMLEs because we do have the bridge curriculum that we call the 5th trimester to prepare the student for the USMLE. Apart from this, if somehow you are not able to qualify the USMLE Step 1, you can look for the Caribbean options where we have the CAMC exam. You can qualify the CAMC exam and you can practice anywhere in the Caribbean because we are the CAM approved institution, so you can practice here. Okay? In the rest of the world, you can go back to India also, you can do the rotation because the Spartan is the only one that has the rotation in the Jamaica also. Okay? Where you can do that rotations and you can go in anywhere in the world and you can practice by qualifying the examination of the particular country. Yes,
let
Dr.
me elaborate.
Ishan, you can take over if you want.
Yeah, let me just elaborate a bit on this. Students can do the clinical rotations in USA. Now, if you want to do your clinical rotations in USA, you have to clear Step 1. There are also other clinical rotations that Spartan offer. A student could do the clinical rotation in St. Lucia as well. They can do it in Jamaica. There are a few other countries. And most importantly, students can also do the clinical rotations in India. And let me also be bold enough to state here that it's not a matter of if you clear your USMLE Step 1, it is only a matter of when you clear. Once you clear, when you clear, you will be going to United States. 90-95% of the students, they clear it in their first attempt itself. And some of the few unlucky ones who do not clear, maybe due to medical grounds or something, they'll clear it in the next attempt. So I don't think you need to worry about clearing Step 1. You should go in with a very positive frame of mind and conquer USMLE Step 1. It's not going to be that difficult for people or for students who have studied from Spartan. I hope this answers this.
And I think so far the Indians are the best actually. They qualified quite a well percentage.
Right, right, sir.
Fantastic. So I think that's it. There are no more questions being asked at this moment. I would just request all the students. There are many students already there. I think it is the best of the chance for them to actually go through.
Right. So till they ask some questions, let me point out some of the questions that most students would have. So see, when you select a medical option that you are going to do your MBBS program, the most important thing to consider is the quality. What type of college or what type of university would you select? So in Spartan, the student to faculty ratio is 10:1. Whereas in India and in some of the other countries, it is close to 150:1. Generally, if you do your medical education in India, during anatomy, you are supposed to do dissections on human body. Now, generally 150 students, they cover up a human body and they do the dissections. Whereas if you do it from Spartan, there would be just 10 students who would be doing dissection at a time. So you would get really nice hands-on experience and knowledge. The student to faculty ratio, the kind of professors that there are, about 50% of the lecturers are from India, the rest of them would be from USA and Canada. So the overall development, the personality development of the student also plays an integral role in how successful a doctor he can become. Most of the lecturers would use, latest technology and, like PowerPoint presentations. All the students are asked to present one or the, presentation on some or the other topic every week or every 10 days. So the kind of knowledge and exposure that the students would get would be the best. It would be at par with US students. And the second thing that the students should consider is safety. Now, St. Lucia has been ranked among the top 5 tourist destinations in the entire world since last 15 years. The entire economy of the country depends on tourism. Why I say this is, this country is considered to be one of the safest on earth, because if in case they do indulge into crime, the tourism industry would take a hit and most of the native St. Lucian people would lose their livelihood. So quality should be a number one prerogative to decide on which school you want to take admission in. Spartan University of Health Science is among the top 10 universities in the world. The number 2 should be safety. It's one of the safest places on earth. Now, number 3 is environment. Whether or not your students, especially Indian students, would be able to cope up with the environment there. St. Lucia being an island country, the weather is more or less similar to India. Generally, the temperature ranges from about 20 to 35 degrees, and that is it. It's an island, tropical island. Okay. The other thing is about 10 to 20% of the population in St. Lucia are Indian. So it's very easy to find Indian food, and it's very, there are quite a few Indian temples and mosques and churches. So your students won't be, your sons or daughters won't be too far away from Indian culture. So number 1 is quality, number 2 safety, number 3 is adaptability. Your students would be easily able to adapt to or acclimatize to the environment in St. Lucia. And number 4, which I consider should be the number 1 priority, is the prospect. Now, if you do your MBBS from India, you will have to do your PG. An MBBS doctor won't earn more than 50,000-60,000 rupees in India. And over a period of say 6 to 7 years, I doubt if they will be able to even earn 25,000 to 30,000 rupees. If you want to get into a PG in India, you have to be among the top 5. There are 17,000 PG seats available in India. 9,500 of them are from private medical colleges. So you can only imagine how many students would be applying for PG. You have to be in the top 5% or percentile in order to get into PG. If you do not do that, you'll have to pay more than 2 CR or 2.5 CR to get into PG. After the completion of your PG, you will then have to set up your own hospital or your own clinic, or you have to work somewhere. So after a period of 9 to 10 years, having invested about 8 to 10 CR, at the end of the day, you would be earning about 2 lakh rupees per month. Now, the prospects that all these students would have if they do their MBBS degree from St. Lucia is, you can apply for residency in United States. Now, all of us, we have 2 eyes, 2 ears, 1 nose, 2 hands. Now, if 50% of international medical graduates can get into residency or PG program in United States, we most certainly can. We just need to be above average in order to get into USA. So this is the most important point, the prospects. You can always come back to India. Yes, Mr. Shah.
Sorry. There are at least 10 questions, 15 questions which are just parred in actually suddenly.
Oh, okay.
So I would like you to address this particular question also, that there are some interesting questions. What is, there is one from Akul Agarwal, okay? Akul Agarwal is asking, is it easy to get visa for USA for clinical rotation once you pass out from, the Caribbean islands? What is the process of getting the visa?
Mr. Shah, let me take that question.
Yeah, please.
Okay?
Please, sir.
As I just announced, that Spartan Health Sciences University now is able to get that medical clerkship visa for our students, for our Indian students only. Okay. This one is a new announcement. I mentioned a few, I think the last week to Dr. Ishan Mehta also. So we have now the tie-up with the hospitals in the Arizona, okay? And that hospital is ready to give the sponsorship letter to our Indian student, okay? So after completing the basic medical sciences and qualifying the USMLE step 1, school will get the letter from that hospital, from the Arizona, for the student to apply for the US visa, okay? Where you can go. The one possibility is that your visa is up to your credentials only. If you are not able to fulfill the financial obligation, then there is a chances to get rejected. Otherwise, your visa is now 100% secure to get into the US.
Okay.
That's
Thanks,
great, sir.
Dr.
And let me
Pandey.
also elaborate
Yeah.
a bit on this. Yeah, let me also elaborate a bit on this. So most of the students, Indian students, won't have a problem in getting United States visa. The only thing is, in their bank account, they need to show that they'll be able to take care of their living expenses in United States. The university already has contracts with these hospitals, so you will get an invitation letter from this hospital, and it is not very hard. As Dr. Pandey pointed out, it is more or less 100% secure that you will be getting your US visa. So I don't think getting a US visa is that big of a problem or a concern.
Oh, wow. Okay. Thanks, doctor. There is one more question. I think some people who joined in late, they have not gone through the cost part of the cost and the scholarship part of it. So I think for them, we can actually I can go back to them to exactly showcase the whole presentation at the the cost part of it.
Right. I think there is just 10 minutes left. So
Yeah.
you can also these students can also send them your send you their email ID, and
Yeah.
you can
I
email it
have
to
their
them
email
as
ID.
well.
Yeah, we can do that. But just for the since it is going
Yeah.
on, it is
Sure.
the cost is
Yeah.
available over here just for a glance. That's a common question by 3-4 people actually over here. So I thought it will help
Right.
them.
Right.
Oh,
Okay. One more question
Yes.
is, what is the scope of PG from other country like Russia and Belarus versus Saint Lucia?
See, for if you want to do your PG in United States, it is mandatory that you have US clinical experience. I just some time back, I just told everybody or intimated everybody that 50% of IMGs who apply, they get into residency position. Now, of the people who get into residency position, about 75 to 80% of them are from Caribbean medical schools. So it is very important to note that US clinical directors or residency directors generally prefer students who have got medical education on the basis of American system of medicine. In Russia or say China or say Belarus or even say India, we follow European system of medicine. And clinical directors, residency directors in United States, they prefer students with US system of medicine, and it is mandatory for students to get US clinical rotations, US clinical experience in order to be eligible for residency position. It is not impossible for Russian medical students to get into residency position in USA, but it is very, very, very difficult, almost improbable, whereas it would be much simpler for students who have done their medical course from Spartan to get into residency position in USA, because they would have done their clinical rotations for 2 years in USA. Their letters of recommendation would be by US doctors. Another requirement to get into residency position is letter of recommendation. And again, the residency directors, they prefer letter of recommendation only from US doctors. So it makes a huge difference if you do it from Caribbean Medical School, as 80% of IMGs, who get into residency position have actually studied from Caribbean medical schools. And I'm sure Dr. Pandey would also have something to add into this, sir.
that's definitely the basic things about the Spartan Health Sciences University. We have with us the three people, so and those are involved. I can say our Dr. Rao, who is basically the president. He is involved in the residency selection, and that's how we can say our residency match is way high. Okay. The secondly, we do have our vice president, or that's Dr. Iyer. He's basically the dean of the George Washington University. He is the one of the board members, standing board members of the USMLE examinations. Okay. Then we have our Dr. Granger. He is the clinical dean. He sits in the Baltimore. He is the one of the ECFMG member to offer the licensure to all the resident students also. So these three are the panels on the higher side with us. Those usually recommend us or usually suggest us how to proceed with the higher match into the residency. The basic things with the other school from the Russia and from the other countries, the moment you spend the 7 years or there in the completing the UG programs or the 6 year in completing the PG program, and then you usually do the PG, your lack of experience in the US system, it affects a lot to get into the residency. After getting the residencies also, the success rate to get the licensure in the US is very, very low. Remember, residency is a training program. Once you successfully do the residency, you have to qualify the USMLE step 3. Okay? And that's where the most of the students or the you can say the international medical graduates from the other countries get stuck. Okay? Our step 2, that is basically for the clinical knowledge and the clinical skills. Okay? That you can easily qualify once you are doing the experimentations or you are dealing with the patients in the US. Okay? That becomes very easy. Okay? So these are the few things. Residency licensure is basically depends on the qualification of your USMLE step 3 only. Until unless you are not qualifying the step 3, you are not going to get the licensure. And the success rate with the USMLE step 3 passing rate is almost 100%, or we can say the 99% with all the schools with us actually. And if I look for the last year report of this one, the success rate of the step 3 is only 17% from the other countries. Okay? So that makes a huge difference, 17% and the 97%.
Wow, that's fantastic. I think people should be able to understand, but in any case, for the people who are looking for Russia and Belarus, we just have one small announcement in between that the failure rate of MCI screening test in India for those who come out from Russia or Belarus or Kyrgyzstan or China is so high. In fact, June 2015, only 7% of the students passed out. We, as an education consultant in India, are the only people today, for every student who is enrolled, they get 6-year MCI coaching. Okay, so when you compare the success and the failure, suppose if you go through any other consultant to Russia or China, and if you are not going through a full 6-year course for MCI screening test, okay, when you are studying abroad, it's going to be equally difficult to pass MCI screening test. Then it is easier to pass even USMLE 1 with a 97% of success ratio. So if you want to know more about MCI, there is a very small website that we have created, but it is exhaustive on knowledge of MCI. It is fmge.moksh16.com. So that will give you a comparison between the MCI screening test success, and from our discussions you can understand the success of USMLE 1. So on this basis you can compare and select and deselect. We have few more questions, sir, here. What is the total cost of hostel, visa? I think we already answered that.
Yes, we did.
I think the living cost could be estimated.
There are 2-3 people who are asking me, let me say, that they attended one conference where someone told them that if they do it in USA, I have heard many, I'm just reading out the question. This is from Ihab Sheikh. I have heard many Caribbean students don't get good clinical rotations. For example, they get psychiatric hospitals for 2 years. How do I know it doesn't happen to me? Sir, it's for you.
We guarantee clinical rotations in United States, and as per the curriculum, you have to do a green book ACGME approved clinical rotation in surgery, in medicine, in pediatrics, gynec. So all the core rotations would be ACGME and Green Book approved, and so would be the elective rotations. I'm very grateful to this student or this parent to ask such a question, because we cannot put more stress on this question. Most of the Caribbean medical schools would just offer you observership. So say if you do 2 years of psychiatry rotation, it's not going to help you. You won't even get a degree in medicine. And I'm sure Dr. Pandey would be,
Yes,
would be in a better
definitely.
position. Yeah.
I would just want to add the one sentence into Dr. Ishan method. Remember, this observership is not a hospital based. It's basically a local contract with the doctors in the particular hospital, okay, where the doctor is responsible for the one department, like the question raised for the psychiatry. So maybe the doctor who is in charge of the psychiatry department, he is offering locally the observership. That's not a clinical rotation, okay, and you have to follow the same doctor for the whole 2 years, because they don't have the other rotations with them, okay. So that's where it's called as an observership. It's a damn cheap, and that's where you got stuck. You will get the degree from the universities, they will offer you the degree, but you will not be eligible to register in the ECSMG. That's the one of the problem. That's the one of the major difference between the observership and the clerkship with the hospital.
I think Ms.
It's
Zainab,
basically observership is the doctor shadowing.
Yes, and we would guarantee everybody clinical rotations, ACGME approved and Green Book clinical rotations.
Yes, definitely.
And in good prestigious hospitals in United States.
yeah, Zainab,
All the hospitals that we have are actually the teaching hospital. There is no rotation that we offer that you are going to stick with the one topic for the whole 2 years. You have to do all the rotations with us.
yeah. I have one similar question from Zainab. I think she has asked me many questions, but due to time I am not able to. But I want to give this similar question. I had attended a conference where they had mentioned that Indian students do not get admission for gynecology or oncology and other big shot medical fields. Why so? And she also has asked one more question. I have learned from what I have heard, the medical education in India is more practical, leading to these, special fields. Is it true?
No.
Yes.
Very
Basically, for the first part, I will take the chat. Is the same answer that Dr. Ishan Mehta and myself gave to the earlier question. Whatever international conference or the conferences you attended, maybe the particular school is not offering in the clinical rotation into those subjects. That's why they were saying, okay. Otherwise, our student usually does all the clinical rotations with the Green Book and with the ICFMG certified one. And I think Dr. Ishan Mehta wants to take the second option, why the Indian is the more practical.
I'll be very, very clear, and I'll be generous on the other conference as well. But Indian medical system is actually not practical. If you just about 3 days back, and Supreme Court of India has come down very heavily on MCI that most Indian doctors are not up to the mark. Indian medical system is 4.5 years you study in a college, and 1 year you do your internship. And in this 1 year, there are 150 students. There would also be PG students, and there are not enough patients in medical hospitals in India. There would be about 150 PG students in each year. So a total of 450 PG students and 150 last year students and 150 interns. So that takes the number to 1,000. So 1,000 doctors in a hospital. I don't think there are even 1,000 patients available. Again, the system of education in India is there is an examination conducted every 1.5 years. Most students, including myself, we exclude some of the portions from the syllabus as it's not generally asked in the examination. If I can speak in Hindi, option में क्या निकलेगा? That is the first thing every student, be it a doctor, be it a law student, be it an engineer student, would ask his or her friend. So the system of education in India, I think, needs to be overhauled, and Supreme Court has come down very heavily on MCI. Just 3 to 4 days back, they have appointed Justice Lodha to review the whole system, and there might be huge changes in Indian medical system. If you want to make it big in United States, I think Caribbean medical education is the only way to go forward. It is almost impossible for Indian students to go directly to United States for the basic science, as you need MCAT, a GPA of more than 3.8, 3.9, and an MCAT score about 31, 32. So this makes it very difficult for Indian students to directly go to United States.
Yeah, one more question. Thank you, doctor. This Mr. Akul Agarwal, I think I made him wait for a long time, but there are many questions asked by Mr. Akul Agarwal. So I'm just searching for the right. There are actually many questions there are there. One of his requirement, is it okay? I think Akul, we already gave you the answer to your question, that how will we get the visa for the US for during your clinical rotation. I think Dr. Pandey himself gave the answer. There is one more question from him.
No, the one thing, Mr. Shah, that I want to make an announcement here.
Yeah.
From the Spartan Health Sciences University, as an official, or you can say the dean of the admission, I'm announcing this one, that the MOKSH educations or the residence education with the Dr. Ishan Mehta is our exclusive authorized partner to recruit the students for us. He is our authorized consultant. And what we are going to do recently, we are going to send the documents to Mr. Dhananjay Shah and to Dr. Ishan Mehta, where all the students, they can visit their office and they can see all the hard copies in person as well.
Oh, that should be fantastic, sir. Now, this Akul Agarwal has a very typical question, and I think it was long due that somebody asked this question. Can we practice in New York or California or Florida? I have read on your website we can't practice in these states if you are from Spartan.
Okay, and let me explain that one. We are in the process of the New York accreditation. Okay? And because the New York is still pending since 2009 with us, okay? So it's still in the process. Okay? Remember, you can do the clinical rotation until unless you are not accredited. But once you get the residency and you get the license, you can go and practice into the New York. Okay? California, from the January 2015, okay, onwards, our school is open to practice in the California. Okay? Our 4-5 earlier graduate, they started practicing in the California as well. Okay? The only issue is until unless you are not going to get the accreditation, you can't do the clinical rotation in California and the New York. And that's where we are in the process with them.
But except for these three places, Florida, California, and New York, I think most of the other places...
No, you can do in the Florida as well. Okay, it's the Kentucky, New York, and the California.
Oh, okay. So rest of the entire US
okay?
is available.
So Florida is all. Rest of the entire US is open. Okay.
Okay. Fantastic.
And the basic problem with that one, because the California and the Kentucky, Kansas state, these are the two states. Those made the basic requirement is the BS degree.
Okay.
Okay. Before starting the MD program, you have to have the BS degree. And that was one of the reasons why we are encouraging our students, especially the Indian students, to have that 1-year program, get the BS degree, and then enters into the MD program.
Okay. Thank you, sir. Sir, there is one question from Ramesh Kanani. Okay. He says that if the student gets, as per your experience, if the student had 60% in PCB in 10+2, physics, chemistry, biology, will they be able to catch up the USMLE standard at Spartan?
As per our teaching, yes. As per our teaching standard, yes, you can. The only problem that I'm facing here, like I mentioned, the scholarship standard. So you will not be eligible for the scholarship. Okay? Remember, this 20 months of the time that you are going to spend here, the 3-year period so in St. Lucia, it's basically the drilling exercise along with the basic knowledge to prepare you for the USMLE. Okay? We have seen a lot of students, those scored the lower percentage, but they did very well in the USMLE. So it all depends on your enthusiasm to do that one.
Wow.
It doesn't matter when you are going to realize and when you are going to start to work on for the USMLE.
Fantastic, sir. Sir, there is one question from Ihab again. 2 questions. I will read it out for you. How long is the pre-med? I have seen in some other Caribbean schools saying it is 1.5 to 2 years. I would like to know about the foundation year only. I am ready to do the basic science 2 years at Caribbean.
Okay. Basically, the pre-med program at the Spartan is the 16-month. Okay. But if you are coming from the Indian system, it's basically a credit-based system. Our Indian system, 10+2, or you can say the intermediate, offers you the 60 credit hours. Okay. And basically, to enter into the medicine, into the basic medical sciences, you require some 90 credits. Okay. So the 2 trimester of the pre-med, that you can say the 8 months, is more than enough to get the another 30 credits. Okay. That's where you can enter into the medicine. But what we are offering now under this program, it's a 1-year program. That's a foundation program. So it will include the 1 year of the pre-med and the 2 trimesters of the BS program. So within a 1 year, you will be awarded with the 1 BS degree and you will get the 142 credits. Okay? And that makes you higher than the US candidate as well. So it's a 2 choice that you can choose between among these one.
Okay.
Either you can get the 90 credits by doing the 2 trimester of the pre-med, or you can just add the 1 extra trimester, get the BS degree and move on into the basic medical science.
Yeah. Now we have one more question, sir. Probably we are running out of time. For every student, there is one thing that I want to say, that we will be noting down the questions and you will be getting individually answers to every questions that you have asked. I'm really thankful for all the enthusiastic, responses that you have come out with. Now, there is one question which is interesting right now, which could be interesting for everybody. Do we have the option of selecting any branch of residency? He has written any in the capital. That is Ihab Sheikh. That is one question. And second question is by Kunal Jasnani again. During clinicals, whether the hostel and living expenses will be the same as those in Caribbean? These 2 questions, sir.
Okay, the first thing, the residency in the US is not up to you. Okay, it's a matching procedure that's going to be allotted. But we know the procedure. We usually recommend our students how to get into their choice of the residency. And that's where the moment I was telling that we do have our 3 major hierarchy, those are involved into that system. They usually comes every trimester and suggest our students how to get into the choice of the residency. Sometimes it takes time also, because if you need the cardiology or something, you have to have some clinical rotations a little bit extra into the cardiology. Okay? So you have to do a little bit extra. You have to have some publication in the same field. So that's where during the matching, they will feel, okay, you have the more interest toward the cardiology and they will allot you the cardiology. It's not your choice. It's decided by the residency board. Okay? But your experience and your basically the clinical rotation decides, okay, in which rotations you are going to get into that. Okay? The second thing that you asked is by the Kunal, I think, is the living expenses. No, it's not the same. Okay? It depends on the site of the clinical rotation, where you are going to have sometimes the cheaper living expenses, but in the some places, like if you are going for the Las Vegas, it's way expensive. Okay? But if you are going to do the rotation in the Chicago, it's a cheap. Okay? If you are going to New York, it's expensive. Baltimore is the cheap. Atlanta is another side, that's a cheap. Arizona and the Phoenix is the cheaper option. So the living expenses that's shown here in their slide, it basically the average expenses that you are going to expend for the 20 months. Okay? So you are going to have the fluctuation in the living expenses as per the site, as per the kind of the rotations you are doing during the course of the clinical rotation.
Wow, thanks, sir. Thank you, sir. Now, there is one last question probably we could take now. I think the whole thing is getting over now. So this one question is from Asutosh. I think Asutosh asked me many questions again, but I have not given justice to him. How do I go for super specialization later to this degree of USA if I intended to do DNB or MCH in India? So probably Dr. Ishan, if you're still on the line, if you can just
Yeah.
take care of this.
Yeah, I just got the audio back. I apologize if I was cut off in between. If you are doing your residency in United States, you might not need to come back here and do your DM or MCH program because like I said, the neurology program, the residency program is in fact a specialty program. Like Dr. Pandey was just suggesting, there is also this cardiology program. So residencies varies from 3 to 5 years in United States as well. So you can, if you are going for surgical residencies, neurology is a 5-year residency program, and then in the same hospital there are also 1 year, 2 year specialization, super specialization programs that you can do in United States as well. So if you do get into residency program in United States, my advice is at least try and be there for the next 5 to 10 years because generally students who have completed the residency program in United States would earn anywhere between 200 to 300,000 US dollars. So that's not the kind of pay that you'll get in India. And you can do your super specialization in United States as well. And I think if you want to add something to it, Dr. Pandey, about super specialization in United States.
Yes, after doing the residency, actually you can add the 1 year of the course like the DNBs and so many courses are available and that's a super specialized course. And the one thing that I want to add here, remember after qualifying the USMLE and doing the residency in the US, all the countries in the world, they are going to accept you without any examinations. Okay, almost all the countries, almost. Okay, so for whatever countries we know where our students are practicing after doing the residency in the US. Okay, it's very easy. Wherever you go, the US degrees or the US residency is well accepted. Okay. Wow. Even in the Canada, if you want to go to practice into the Canada also, they have the MCE exam. That's the world's toughest exam. But if you complete the residency in the US, it's only the formal registration that you have to do and you can practice anywhere in the world. Okay?
Yeah, that is what even most Canadians would do because you are clearing USMLE step 1, step 2 is easier than clearing the
That's how most of the Canadians, they usually come to us. They complete the course and do the residency with us and then goes back to the Canada and do the practice directly.
Yes, and it's also important to mention here that Indian students who would be going to say Spartan would be studying with American and Canadian students as well. So yes, that would also help them, to develop their personality and to know how to learn and how to get into the system.
Yeah, it's a kind of hostel accommodations also that we are providing now. It's American accommodations, how to live, because from the day one you are going to learn how to live with the American culture. Okay? The only things I know the Indians, we Indians actually, we are very prone to the Indian foods and some of the facilities. So those modifications we are doing to provide you people. But slowly we try to convert you people into the US culture.
Right. Sure.
I think we lost him.
Hello?
Hello?
Yes?
Hello?
Hello? Hello? Yes? Shah?
Yeah, I think we almost lost your voice right now. I think
No. Okay.
Okay, I can hear you now.
I think Dr. Ishan heard me clearly all the explanations.
No problem. I think, sir, we must thank you for this entire time and the guidance that you have given us. And I hope that we can spend, like this. If there are students who would like to know more about this authentically and honestly and clearly about the opportunity to study in India, in USA, then probably we would like to invite you further, for more such opportunities on through the webinar.
Sure, sure,
And
sure.
we also look forward to see you once, back in India, to, those who are finally interested, if you can meet them personally and guide them further, after they finally take a
Yes,
decision for it.
definitely. I'm planning to come in the month of the July, as I discussed.
Fantastic.
I'll be
Yeah.
available.
Okay.
Okay, and then we'll have, and by the time I will provide you all the documents to
Yeah.
solve the queries of all the students
Yeah.
related to the visa and everything. I will provide you the documents.
Okay, sir. Now I would,
Just got the audio back. Yeah.
yeah, Dr. Ishan, I must thank you as well. If you can hear me, can you hear
Thank you
me?
so very much. Thank you. Yeah. Yes, yes,
And
I just got the audio back. Thank you so very much. Yeah.
yeah, and I must thank all the guys and the girls who are trying to be, I wish them all the best for your journey towards MBBS. Here at MOKSH, we are definitely, always there to help you out. You can note down these numbers or email IDs, and of course you must have noted down the website address. It's very easy. It's not a problem for you to actually worry about, the admission system. The whole system has been easily made for any country that you choose, including USA. So just go for this, website, select MBBS, select your country, and it's done. You can select the university here, apply now, and it's done. There is absolutely no need of advance money. Please do not give any advance money to any agents whatsoever. And in case, the thumb rule is, if you go any other country except USA, if you happen to go there, do not go without MCI screening test 6-year coaching. If you do, they take care of these two aspects. I think MBBS is not a problem for you, any one of you. I think I must thank all of you, including Dr. Pandey and Dr. Ishan, to join us and give this very enlightening, the knowledge and the
Thank you very
guidance.
much, Mr. Shah, for inviting the session. It's a really enlightening session to answer that.
Thanks a lot. Thanks a lot, everybody.
Thank you so much, Mr. Shah.
We'll get back to you. Everybody will get a recorded message, recorded presentation, including the audio, by email within the next 2 to 3 days. Okay? Thanks a lot, sir. Thank you.
Thank you.
Thank you.
Thank you.